Hemostasis, not homeostasis, not hematopoiesis, but hemostasis. Hemostasis, stasis like stationary, stop, hemo, blood, stopping bleeding. Homeostasis is, of course, getting to that set point, and something I failed to mention in the previous video, hematopoiesis, or sometimes you'll see it called hemopoiesis, that is the production of new blood cells. So we are talking today about hemostasis. So as you can see from figure 1912 in your text, this is a complicated process. So let's come back to this, but let's think of it just a little more simply to start with. So this process of stopping bleeding really happens in 4 phases. The first is called the vascular phase. And so here we see, ouch, a knife blade cutting through a blood vessel. And what you're going to have in the vascular phase is a constriction of the smooth muscle, right? Basically vascular spasm, constricting that vessel to decrease the amount of blood loss. The damaged endothelial cells are releasing chemicals called endothelins, and these are actually going to be the basically like a paracrine factor, a localized factor that cause the smooth muscle and contraction in that blood vessel. It's also what causes the endothelial cells to become sticky, which is what we're going to see here in our second phase. So the platelet phase, and this is actually a really brief phase. The vascular phase can last around 30 minutes. The platelet phase picks up kind of during the vascular phase, like right at the beginning, and it's really brief, like 15 seconds. And basically, platelets are attracted to those endothelins, and they start attaching to that sticky endothelial surface. So we get adhesion, aggregation, right, sticking to each other, and forming what's called the platelet plug. Those platelets that are now attached start releasing the chemicals that are going to set off this whole positive feedback for clotting, right? So few platelets stick, they're attracting more platelets, and now we're going to start releasing a bunch of chemicals. So the third phase is called the coagulation phase, and this is the part that's probably the most complicated, but this is also when you truly form a blood clot. So it's a complex series of events. It requires like 11 different proteins. You need calcium to make this happen. But honestly, what you really need to know, right, is that where's my pointer? At the end of all of this, right, so we see there's actually 2 different ways to kind of trigger this coagulation phase, but notice they come together. They're referring to this as the common pathway. And at the end of that, we have a protein called thrombin, which takes fibrinogen. Remember the ogen was that like precursor protein. This is one of the ones that we said is actually just like circulating out in the plasma. So thrombin cuts fibrinogen and turns it into fibrin. And fibrin is truly that protein that's involved in really meshing that blood clot together. Now, these 2 pathways, this will become important as you start thinking a lot more about disease. Basically, the extrinsic pathway is really the normal pathway. So in this, it's from an external injury. Extrinsic pathway, external injury, normal injury, the endothelium gets damaged. This intrinsic pathway is problematic. It's more like this abnormal exposure of collagen fibers in the endothelium. So this would be like injury that maybe you don't see. It's not like a knife blade. It's like the chemicals in cigarettes damaging endothelium and can actually trigger this intrinsic pathway clotting. This is why smokers are more likely to have, say, pulmonary embolisms, to have these clots. Okay. The fourth step then is clot retraction. So interestingly, inside the platelets, you actually have actin and myosin, just like in skeletal muscle, and they will actually slide past each other to try to pull the edges of the injury past each other. Now, in your text, they give you this image, and it looks a little crazy at first, but it's actually pretty cool. So what they're showing you here, right, what they're emphasizing is it's really the damage in the blood vessel. It's the exposure of that collagen that kind of sets things off. So the platelet is attracted, it's actually attracted to von Willebrand factor, but don't worry. Just go with the platelet is attracted to that exposed endothelium for now. And once it sticks there, right, notice it starts putting out these different chemicals. That's actually attracting more platelets to the area. And then here they're showing kind of that coagulation cascade, right? Again, extrinsic pathway or intrinsic pathway, they both are going to end with thrombin taking fibrinogen, breaking it into fibrin, and that's your clot. All right, so that's really kind of the key things that you should get there. It is a very complicated process. Positive feedback because it just keeps triggering the next thing and the next thing and the next thing, accelerating that clotting. Now, eventually, of course, you don't want that clot to stay forever. And so you would, after all of this is over, go through a phase called fibrinolysis. Lysis is splitting of the fibrin, and that's really when you start to have that clot breakdown. Thinking about the control of that clotting, do keep in mind that some things can kind of interrupt or accentuate this clotting process. So if you think about giving someone pharmaceutically something like an anticoagulant or heparin would be an example of an anticoagulant, or even something like aspirin that's supposed to decrease blood clots, those are all jumping in here and kind of interacting with this coagulation phase. A couple other things to keep in mind with clotting: calcium is absolutely necessary for this to work properly. So when you think about blood calcium levels, we talk about it in first semester, how that calcium is important for things like skeletal muscle contraction. But now think also, hey, you have to have the right levels of calcium for blood clotting to take place. So now parathyroid hormone, calcitonin doing their job starts to make more sense. You also need vitamin K in order for this to work. There's actually 4 of the different clotting factors, right? These all have like different little Roman numerals here. 4 different clotting factors actually require vitamin K. Primarily that's produced by some of our intestinal bacteria. But anyway, so you need that. Okay, I think that's it for clotting. That was a quick one. Okay, we'll see you again soon.